wrist hanging off the table enough to fully allow the wrist to flex? What are our landmarks going to be?
Ulnar styloid, Borasi's fulcrum.
Close. Not the ulnar styloid, though.
Radial?
Go a little distal to the ulnar styloid. What's the next structure?
Third metacarpal.
Lateral, not anterior, just straight lateral to the ulnar styloid process is the, yes, triquetrum. You guys read that well. I saw you looking there. So the triquetrum is going to be our fulcrum. What's our stationary arm? Olecranon, and what's our moving arm going to be?
Fifth metacarpal.
Fifth metacarpal, very good. Everybody grab your fifth metacarpal. You can move that fifth metacarpal without flexing or extending your wrist. Be careful not to bias your results by using that fifth metacarpal to move. I can get probably 30 degrees of motion without her wrist ever moving. So even though the fifth metacarpal is going to be our moving arm, be careful not to use it to grab and move from. When we do the wrist, we're going to use the second and third ray to move. Those are relatively stationary, whereas the fourth and fifth rays move a lot. So, we're going to align our goniometer. Palpate our landmarks. We have the triquetrum, which is just distal to the ulnar styloid, the olecranon, and the lateral midline of the fifth metacarpal. Take your patient through a full range of motion. Any discomfort with that? Good. We have a firm end feel right there. Please be practicing your end feels. Also, with flexion, be sure that your end feel is not a table end feel. Get your patient's arm forward far enough to avoid the table, and we would approximate that she's about 90 degrees. Take your patient out of that position, have them relax, set your goniometer. Again, go through that same range of motion. Any discomfort? And again, your pressure is not on the fifth or the fourth metacarpal, it's on either the second or the third. Once you're at that end range, you're going to stabilize and take your reading. Questions? We're going to go from there right to extension. Identical landmarks. Again, you want to use the second and third rays for your pressure. Any discomfort with that? Have a firm end feel. This time it's a little more firm than the other direction. About 80 degrees. Relax. Set your goniometer. Take your patient through the range of motion. Any discomfort? And record your reading. Got those? Good. Can you guys see? Or are you just looking at my back?
No.
Okay. You can move if you need. For radial and ulnar deviation, you're going to support your patient's hand as well. What are our landmarks going to be? Lateral epicondyle is going to be our stationary arm. Capitate. And
Dorsal midline of the third
Third
metacarpal.
metacarpal.
good, dorsal aspect of the third metacarpal. How do we find the capitate?
That's third finger.
In the hole.
It's in the hole. Go down the third ray, the third metacarpal. There's a little hollow. If you flex, capitate comes into your hand. So you find that hollow. If you need to confirm, gently flex your patient's wrist, and it should come into your hand. That's going to be your fulcrum. So begin by aligning your goniometer. We're going to radially deviate first. Now, most of the end feels we've done have been firms to this point. Radial deviation is one of the end feels that's going to expectedly be hard. You'll see that the scaphoid bone is usually the structure that limits radial deviation. Do you have any pain with that? We have a hard expected end feel, approximately 20 degrees of motion. Preset your goniometer. Again, stabilize, take your patient through the range of motion. The table and the friction of the skin on the table will help you a little bit here. align your goniometer, take your reading. We're going to use the same landmarks as we do ulnar deviation. We would expect approximately 50% more motion going ulnarly. We're looking for about 30 degrees of motion and a firm end feel. Any pain with that? Good. Take your patient back to the middle. She has approximately 30 degrees. Preset your goniometer. Take your patient back through the full range of motion. Any discomfort? Good. Maintain your stabilization as best you can. And she has a lot of mobility here. We have more like 45 degrees. That's the entire wrist. Questions? Okay. It would be okay to use any one of the goniometers that I have in my hand. This a little less so. These would be ideal. This would be too large. So take one of your small gonies. You have 10 minutes to practice all.